sort of going on to PRP and hair loss, because I know that's a treatment we offer. We've got quite a lot of patients who are on that pathway at the moment. How effective is it?
Oh, it's really effective, actually. There's been a number of different studies done on PRP in particular. Again, looking at androgenetic alopecia, because there's different types of alopecia. And so I'm just going to talk about androgenetic alopecia, because if you have telogen effluvium or if you have scarring alopecia, then that is completely different. So let's just focus on androgenetic alopecia, where the majority of the promising results have come out. And there has been studies that have looked at how much improvement there is in the reduction in hair shedding, but also increase in the diameter of the hair shaft. And what they found was that in a study in the Dermatological Society, they found that there was an increase in 30% in hair density after 3 treatments over 3 months. Wow. So with hair loss, you do need to wait. Okay, patience is a virtue. And we do a lot of PRP treatments in clinic for that. But I would never say to a patient that it is guaranteed. Yeah. And I would never say to a patient that that alone is enough. And there's a reason for that. Because PRP is different patient to patient. Because ultimately what we're doing is we're taking your blood. And your blood, Sophie, is going to be different to my blood if you drink, if you smoke, if if every day's a Friday, we're having lots of chocolates and crisps, and we're not having our different nutrients and macronutrients throughout the week, 30 different fruit and veg. You're not well hydrated. Your PRP quality may be different to someone whose lifestyle promotes a better quality of PRP. That is just scientific fact, okay? Which is why we do say to our patients 2 weeks before you come in for your PRP treatment, please up the ante on your hydration, drink lots of water, we're going to get better quality. Have your lots of fruit and vegetable, try and stay away from ultra-processed foods. Do everything that you can within your diet and lifestyle to improve the PRP, because what are we injecting? It's not like your body has blood. So it's not that we're injecting blood back in. What we're doing is trying to inject a localized turbo boost of growth factors, these IGF, VEGF, etc. And I think diagnosis is fundamental. Yeah. Because if I had a patient who say is postmenopausal, she's a smoker, she drinks alcohol every day, she's not sleeping, she's not drinking water, I'm probably not going to prescribe PRP because it's going to be a waste of money. It's also going to be unpredictable. So the quality of the platelet-rich plasma will differ patient to patient. Okay. So you've got to choose the right patient. That's super important. And they need to be, it's a two-way page. They've got to do their homework if they want to get the best out of the treatment. Yeah. But in terms of clinical studies, in those patients who have followed that advice, there is significant improvement seen in hair density. The other thing is, I think with hair, and these have been looking at PRP alone, right? PRP is routinely now combined with microneedling, where we microneedle the scalp, creating little traumas into the skin, which in doing so stimulates the wound healing response. So when you have a wound, you've been created such that your body heals, right? So you have a cut, and all of these macrophages and your white blood cells and your neutrophils come to the area, and your blood cells to create new blood vessels, and that's called angiogenesis, to bring new nutrition to the area. So you get this burst of localized inflammation that induces wound healing and collagenesis, new collagen formation, okay? And so you're going to get localized growth factors to the area. So it's turbo boosting. And that's why I say actually multimodality treatments are really important when we're trying to treat scarring, hair loss, anything like that. So microneedling is a huge thing.